rate of $348.78 from his pension of $818.39 leaves them with $469 in pension per month. Therefore, they are dropping her from their plan, and she will have to go without insurance that scares her to death and that just may cause her death. The argument of going from a new plan offering of $195 per month does not hold water. If you calculate the rates versus the maximum out of pocket for the year, if they both had serious health issues in the same year, it would cost them more on the new plan than staying on the old plan. The argument from employers is that the employers are not responsible for all the woes of society. But in the public transportation arena, the employers should be the example. They should want to reduce the claim cost that drives the premiums cost with healthy employees. TriMet should want to be the example in Portland of creative in reducing health insurance cost with healthy employees and protecting their retirees' premiums and out-of-pocket cost. Her husband drove for 18 years, showed up for work on time, did his job, was spit on, threatened, and assaulted 3 times with a concussion and lacerations. Yet he returned to work each time. Yet now all the years are for nothing. TriMet should be the example of a great place to work, about caring about retirees. They should want to be the example of keeping their word to the retirees. Shame on them for not keeping their word to the retirees. Now take those numbers who had dropped their insurance because they could not afford the insurance. They and their families may suffer a catastrophic event and rack up hundreds and thousands of dollars in medical expenses. And say an arbitrator has ruled that TriMet violated the law by unilaterally charging members for their insurance. What is your liability regarding the medical expenses? And let's say this happens to 5 members or 10. Are your attorneys going to cover those losses? Remember, this is all going to happen before we ever sit down to begin interest arbitration, which at this point looks like somewhere in 2012. For the sake of repeating myself, once again, here's what TriMet needs to do. They need to rescind their plan to start charging members for insurance in violation of the collective bargaining agreement. The union is willing to go back to the table while the arbitration moves forward. The parties can settle at any time, right up to the point where the arbitrator makes the decision. If the dispute has been settled by the arbitrator, the union will live with whatever the arbitrator decides. So if TriMet can convince the arbitrator to have the balance the budget on the members of TriMet active retirees members' backs, then so be it. That is the law. And that is what we agreed to. Let the process work, and I request you, the TriMet board, to comply with the law. At this time, I would request that there be a motion come from your board to rescind the implementation of insurance. It's clear today that just of November 9th, there was misinformation given out to our retirees, our most vulnerable victims out there. Request that we rescind, make that motion, put it forward that we rescind implementing January 1. Instruct General Manager Neil McFarland to sit down with me and negotiate this contract, just like it's been done for the entire time. Nobody likes it shoved down their throats. You don't want to continue to see me and our membership here every month. We have an ability to work together. I just settled a contract in Eugene, Oregon last Sunday, ratified by over 85%. We created, and by the way, in 2005 we struck there. And I think the management staff there, although we don't necessarily get along and see on all issues, recognize the importance for both parties to sit at the table and come up with a resolution. We did that. We created VEBA accounts. We created stop-loss accounts. We created co-insurance. We created all these areas in which to maintain level of benefits but reduce the cost. That hasn't taken place here. Those conversations haven't been. We don't have wellness programs here. although I've requested it for years, that we sit down and we make our people healthier, that we figure out better alternatives, that we look at the schedules and how and what is driving our experience rating up. I encourage all of you, don't let the Grinch steal Christmas here. Don't allow this to continue to move forward. We're not going away. I will continue to be here. I will continue to exercise my rights. I will continue to let you know that our membership is unhappy. Nobody, none of you, nobody back there likes it shoved down their throats. We enacted a law in 2007. We, ATU, was the chief petitioner. We did that for a reason. We have not come out, in my term as a full-time officer, have not spoken in front of this board negatively on TriMet. I have not went on the television and talked about issues concerning our areas because we recognize that it's important to work on our issues in-house. We understand the importance and the dedication that goes with all of you, and we appreciate your time and effort of coming forward. But you all, as board of directors, have a responsibility to know the facts and make the decisions. And just recently, we've had some of our members come that spoke to you personally, that have explained that you have not gotten all the information, that you don't know all of the details. And for that reason alone, I request that you make a motion, rescind the implementation, and give it some time. Give it some time for us to go. I encourage you as the president of the board, and maybe some of your other board members, to come and sit in those meetings so you can hear what's going on. So you can hear that there is an ability to resolve this situation differently. But you have forced our hand because you've implemented. Mr. McFarland has stated multiple times that had we not filed the unfair labor practice, that he would not have implemented the insurance. The unfair labor practice is because, and you've gotten that information, we will continue to give it to you, that they changed what was negotiated at the table. That's an unfair labor practice. We filed that. We're not going to hear that until April. There was an amended version when TriMet then retaliated and implemented the health insurance. Those two issues go away. We can focus in on the arbitration and we can continue to work hard till we get to that date. So we're not talking to the end of eternity. What we're talking about is let the process continue to move forward. Let's tell our membership, we appreciate your hard work. Get back and do your professional jobs and allow us to do that. Right now that's not happening. And it's not going to happen for years. That's the part that people don't understand. We are not just meeting today at an airport and we're all going to take off in different ways. I'm going to be here. I'm not going anywhere. And I don't think some of you are going anywhere. We need to sit down and figure out a better way to do this. Implementing, forcing our hand, does nothing but create bitter resentment, and labor relations has not. You ask management, what has been done under labor relations? I have been here for several months. I would ask what you, as board members, have done to investigate and how to solve these problems. You have a responsibility. And I would request that you exercise your rights as the board. Show this membership, show the citizens of this community that when the governor appointed you to these positions, he did that recognizing the experience that you have and the ability to recognize where we need to go. You as the board should be recommending and instructing the general manager to figure out different ways to do this. We all recognize that costs are going up. We all recognize that we've got to figure out a way to do that. But you can't do that if you force our hand. Good collective bargaining does not happen if you're forced. It doesn't happen when you have the gun to your head. And that's what's taken place. Our members are suffering. January 1, things are going to be drastically different. We can all argue the amount. But what we need to get back to is how are we going to do business in the future? How are we going to ask for people to do 110%? The weather's starting to get cold. Look at the collective bargaining agreement and refer to the emergency statute. In it, it talks about the general manager and the president of the union needs to get together. Guess what? That's never happened. So let's hope it doesn't snow this year because we're going to have some major problems. Because I can tell you the last time it happened, I was the only one that had flexibility. I was the only one that continued to move forward on the issues. And it wasn't until after the fact that we got it settled. So we are going to have problems. I'm going to instruct my membership from here on out to take every single rule of TriMet and work to the rule. And we're going to do it all legally. But what that's going to do is, that's going to create a problem. Because your schedules have been based on how these members are able to get it done. And it's created their own problems. People don't collect fares because they don't feel they're supported. We don't have inspectors out there right now because of the cuts. We need to look at all of the money that we're spending and recognize what commitments have we already done. I have not come out against on any single measure TriMet has put forward. My simple answer is this. Take care of those you've already committed to. Figure out a better way to get it done. I'm not sitting here saying I'm not willing to move. I'm not sitting here saying that there is no way we're giving in or making any modifications. I'm not saying that. I've never said that. What I'm saying is do not force our hand, because it's going to get worse. This is the tip of the iceberg. Because the day our members see that drastic change without having good collective bargaining, they're going to be upset. And it's real easy for us to jack our membership up. It's real easy. It's really hard to bring them back down. And representing 23 collective bargaining agreements, I have many different personalities within who I have to deal with. And isn't it amazing that we're able to get done that? I think Neil's actually a nice guy. What's happened is things have been created prior to him coming here. However, now as the general manager, he needs to make that courageous decision. There was something that took place with Mr. Walsh and Mr. Hansen that for the last 15 years allowed and moved this forward. There's a reason why. There's a long history of expertise within those two groups. There's not either one of them standing here today disputing what I've said. There's probably a reason to that. And I would ask you as the board to give Mr. McFarland the helping hand. Tell him that, you know what, labor relations is important. Safety is first and foremost. And how can we do that without having good conversations? I thank you for your time, and I will sit here waiting and hoping today that somebody on your board has enough courage to make a motion. And what are we asking for? Just a pause button. Just some time for good people to get together, roll up their sleeves, and figure out, how did I in Eugene, Oregon make it work? How did we make that? They are 1/10 of the size. How are we able to get down to that? You guys spend a lot of money with Mercer. You spend a lot of money working on your issues. In Lane Transit, I sit down, our members sit down, our officers sit down and talk about how much medication they're using. Not who's getting it, but what are we doing? What's the trend? There was a program created for type 2 diabetes down there that they were able to save money and get early prevention. The lady that I just spoke to, her husband, had he gotten good preventive coverage, had we had some wellness fairs, he could have been checked and seen, you know what, he's got some major problems. That hasn't happened. And we need some leadership to recognize all of the things that we talk about are extremely important. But when we shut it down, when we don't listen to those who do the job every day, we're doing ourselves an injustice. Again, I encourage you to put an ending note on this year. To say, you know what, we're all going to do a better job next year on working together on the issues. And the only way that's going to happen is that we rescind the implementation and then we get back to the table and resolve it. And if we cannot, we have a process set up where a third party will make that decision. And we will live by that decision. I ask you to do the same. Thank you for your time. I'll take any questions.
Thank you. Thank you all. I appreciate it. Next we have Grace Bentley.